So hello, my name is David Wrench, and I'm a medical doctor, and I'm the specific type of doctor I am is called a consultant haematologist. I decided to become a doctor. That was well, moderately long time ago at school, because we have to go to university to treat that, because I had a little bit of experience myself. I had an operation when I was 10, my appendix out, and I was also quite interested in science, and I like dealing with people, and at the human level, I like the chance to help people solve the problems, and I think it's a very rewarding and satisfying career for the person doing it, the doctor, but also because of what we hopefully can achieve for our patients and their loved ones and families and friends, because it's not often just the patient we're managing indirectly in the end. I chose to specialize in hematology because throughout my training, I had increasing exposure to that, as we all do through medicine, and it's diverse. It's an area of medicine and healthcare that's led the way in developing care of patients through treatments and diagnosis. So there's been a lot of advances in the way we diagnose patients, and in hematology we can do that ourselves. We see patients, we diagnose them, and then we treat them often. It's just quite all encompassing and very satisfying, and a real sort of professional challenge there. It's led the way in treatments, so an early sort of adopter and user of the immunotherapy concept, targeted molecular therapies, and now using patients' own cells to treat themselves, cellular therapy. Our patients have an ongoing need for care, and it's very rewarding as a person to meet and manage these patients with a diverse range of conditions. I grew up in the very wonderful city of Edinburgh in Scotland, and I now live in the very wonderful city of London in England, both are very historic, great towns, and they're great places that are very diverse, with a huge range of different people and interests. So the adjectives I'd use to describe my profession are well, dedicated, helpful, and rewarding. Dedicated because I think both us as doctors and all healthcare professionals are very dedicated to our roles and the care of our patients. I think our patients are very dedicated to that process too, and that sort of joint approach makes it very satisfying, helpful. I think we all have a drive to help others in the healthcare aspect, so doctors and all others, and patients want to help themselves, we want to help them, and there's a very good partnership there, and it's very rewarding. So as an individual, it's very rewarding. As a team, I include the nurses and all other aspects of healthcare there. It's very rewarding for us, and to help manage patients and their loved ones. And for patients, we hope it's as often as possible a rewarding experience being managed within their hematology condition, whichever and however of the many diverse ones that may be.